Hello, and thank you for joining me. I'm Rosanna Sabini, and I'm the Medical Director for the Northwell Health Concussion Program. And today I want to speak to you about concussion and the current evidence on the treatment of concussion. Objectives for today are defining concussion and its symptoms, discuss concussion treatment and expectation for its recovery, and describe complications related to head injuries when the symptoms don't resolve. So how do we define a concussion? Well, I can tell you that for every person that speaks to concussion, that's how many definitions there are. But in general, it is a direct blow or indirect force transmitted to the head, and it can lead to transient, short-lived symptoms, which typically follows a sequential course of improvement, where most people recover in 10 to 14 days. And the neurological impairment, if any, is related to more functional than a structural injury. So how do you go about recognizing a concussion? Well, it first starts with an individualized assessment and understanding how the injury happened, whether there was loss of consciousness or post-traumatic amnesia, which in most patients that does not happen, and immediately need to rule out whether there's other neurological injuries such as a spinal cord injury to the neck. When we're talking about sports-related injuries, the first thing to do is to remove the athlete. Usually what's called a SCAT-5 or Sports Concussion Assessment tool is performed, and is performed by healthcare professionals who go through this assessment, and it helps to really identify presence of concussion symptoms and the orientation of athletes, and it's been really well established and vigorous in identifying concussions on the sideline. Ultimately, the player should be evaluated by a physician and a licensed healthcare provider, and that at that point, a plan should be determined whether it should go home to a physician office or to a hospital if it's more emergent. These athletes should never be left alone after the injury, and they should be monitored more frequently just to make sure that there's no progression of the injury for more serious injury. If a player is diagnosed with a concussion, ultimately, they should not be allowed to return to play on that day of injury and need to be reassessed for reintegration back into sports. And ultimately, the final determination of the diagnosis and fitness to play is a medical decision. And typically, every state is a little bit different on how management is performed. In New York State, it has to be a physician that clears the athlete who is trained in traumatic brain injury. So reevaluation is really when I have a role in seeing patients and their concussion. So I perform a thorough examination, go through the history of the symptoms and the injury that they sustained, and then talk about the symptoms that have continued on and how they've changed and what their current activity level is and how the symptoms play a role. The chart that you see here lists a bunch of different symptoms that someone may experience after a concussion. However, this does not itself diagnose a concussion. I also try to understand if there's a previous concussion history, what was the recovery like and how many you've had. I also look at past medical history because there's parts of a medical history that are important and are going to help me tell you and other patients whether or not you're going to recover quickly or more slowly from this, and then perform a neurological exam. So this is how I take a look at concussion symptoms. I look at how all the symptoms that are possible after a concussion, and these are just some of them, but they're lumped into what I call domains, and how these symptoms interact with each other will influence on the other ones. So for instance, if you're not sleeping well, you're probably not going to be happy the next morning. You're probably not going to be very efficient at thinking and paying attention, and you possibly could have a headache. And the same goes for if those have dizziness or have headaches. All these symptoms have implications on how they work together, and my job is to find out what is the primary source of the symptoms so that we can target treatment towards those symptoms. After I take a look at the symptoms and history, I find out whether or not there's need for a neurocognitive assessment or if there's further imaging necessary. Typically, if symptoms from an injury have lasted for a prolonged period of time without significant improvement, I typically refer to a neuropsychologist who will do pen and paper testing. Computerized testing is not recommended, and it should not replace a neuropsychologist. And that test can take 4 to 6 hours sometimes. A head CT or MRI can be performed initially when the initial injury happens, but that's typically not something that is recommended for ongoing assessment of an injury because most likely they're going to be negative and we don't routinely order them. So how is a concussion treated? Well, it starts with rehabilitation as well as lots of education and reassurance. On a day-to-day basis, I'm always battling misinformation about concussion from whatever was read or news piece that they heard. And the reality is that there's a lot of research that tells us that actually rehabilitation and getting yourself active is the best way to recover from these injuries. Based on the current evidence from the consensus statement of the International Sports Concussion in Berlin of 2016, is that after a brief period of rest, there should be a gradual and progressive increase in physical and mental activity to try to get folks to reintegrate back in their day-to-day activities. There's actually very limited evidence that tells us that complete rest actually improves recovery. In fact, it delays recovery because inactivity has been shown to cause other problems related to an injury, and it should be avoided. Because most patients can recover in a matter of a couple of weeks if they're guided in the right direction. Emphasis and education should be geared towards providing information on how to reintegrate into physical and cognitive fitness, and that means that after a couple of days of rest, people should try to get to doing things that they normally do on a day-to-day basis so that they're successful at achieving that at the next time. So every day there should be a level of increase in activity. So if you feel good doing it, you should keep doing it. If you don't feel great at doing something, then you back off, take a break, and try again later. Certainly, if someone is having persistent symptoms and they're not getting better, there are interventions that we recommend for that. We use the term persistent symptoms for those patients that do not recover within 4 weeks. And this does not reflect a pathophysiologic cause or physiologic cause in the brain. In fact, it's thought that the brain has already recovered, but it's the injury to the rest of the body that has been the cause for ongoing symptoms. And that's typically related to the trauma to the whole body, and also related to the inactivity that may have happened in the first few weeks. It's usually a constellation of nonspecific post-traumatic symptoms and may be linked to other factors such as pain or mood problems. So referring to a trained physician that manages concussion and prolonged symptoms after an injury is very important because treatment is individualized. So someone like myself will match targeted and active treatments to the clinical profile. So for instance, if someone is having headaches, but I find out that the neck is the contributing factor to those headaches, then certainly managing the neck pain is the first start to treating that headache. Individualizing management strategies for return to work and school as well as physical activity is very important, and certainly starting a aerobic program that's geared to improving the symptoms while getting folks more physically fit is part of the treatment as well. And someone such as myself will help someone who has a concussion for a prolonged period of time determine whether or not medications or additional interventions required, such as a referral to a specialist or neurologist for ongoing migraines, for instance. Certainly, this all happens with a multidisciplinary approach. So utilizing my referrals, such as a physical therapist or a neurologist, to help with the ongoing management of the symptoms so that we can improve overall recovery and symptoms. So what are some of the risk factors for having prolonged symptoms? Well, certainly the higher the symptoms at the initial state will certainly take a longer time to recover down the road. If there's neurological findings on imaging, such as axonal shearing or brain bleed, that tells us that more extensive damage has been done to the brain, that certainly can lead to prolonged symptoms, but I haven't seen that in patients who've had more severe disease have more prolonged problems necessarily. As I mentioned, physical factors such as pain, sleep disturbance, or even a peripheral nerve injury sustained in the trauma can be a cause for prolonged symptoms. And who is the person and their psychosocial makeup? What were the prior life experiences on coping and new stressors? Are there aspects of depression and anxiety that make it hard for someone to go through this new trauma? Are there return to work issues and potential litigations involved with things such as injuries related to car accidents? So there's no doubt the psychological distress has an effect on cognition, and we all have had some sort of cognitive compromise, and certainly when symptoms persist after a trauma, it shakes one's sense of identity, and we often hear from patients that this is not who I am, it's not who I was, and I'm just different. And so there's certainly a dysfunctional cognitive feedback loop that has been thought to explain prolonged symptoms as well, where anxiety leads to avoidance of certain situations, such as, for instance, driving or returning to work, and can lead to depression. And then this back and forth between anxiety and depression can increase further and causes further cognitive disruption. So the distress intensifies to the point that it may become more disabling than the initial injury. Certainly personality variables, someone who's a high achiever, who's dependent or insecure, can certainly affect interpretation of symptoms and the recovery overall. So we need to assess that and dive deeper into it so we can help folks along the way to make sure that they're getting the appropriate treatment to improve on their recovery. Now you add a student or someone who has to go back to work and all the pressures related to that and the demands can certainly complicate recovery as well. So again, looking at the symptoms here, you see that they're all interrelated and one can add upon the other. So whether it is a fresh new injury or even a prolonged injury, the focus is always to treat the specific symptoms. So if you have a headache, finding out what kind of headache, because there are different kinds and there's different treatments for the different kinds of headaches. If there's dizziness, identifying what the source of the dizziness is and potentially involving specialized physical therapists to help along those symptoms. If there's sleep issues, certainly optimizing sleep with certain recommendations that will improve overall wakefulness during the day and ability to think better and perform better during the day. Certainly if there's pain, we optimize treatment towards those pieces that may be contributing to someone limiting their activity because they can't function if their pain is not controlled, or pain is limiting their sleep. And so how do we direct that treatment? Certainly if there's cognitive symptoms or mood symptoms, we have neuropsychology and counseling geared towards assessing where the mood is and where the cognitive impairments are to help us then provide a treatment towards that. And the most important thing that we can recommend is maintaining an active lifestyle by increasing activity and exercise. So being a rehabilitation physician, it's no surprise that the one thing I will always recommend to my patient is exercise and increased activity. There is nothing but tremendous support in the literature that says that exercise improves neuroplasticity and neurogenesis, meaning improves brain health and neural connections in your brain. It's effective at treating anxiety and depression. It improves cognitive functioning, self-esteem, and just overall sense of self and identity. And it improves quality of your sleep. And in some patients who may have either seen me for the first time after an injury, whether it's been a few weeks or even months or even years, I recommend a graduated protocol of rehabilitation where, with the supervision of a physical therapist, can get you through getting improved exercise tolerance and not be so concerned about the symptoms that you may experience when you try to do some sort of exercise. And this has really been shown not only in my office, but as well as in literature, that with supervised therapy, patients can really improve in their recovery. If there's any further questions, you can certainly reach out to us at our concussion program. I want to thank you for your time and listening.